Hi everyone, welcome back to the C Morning Show. Now in our first segment of talk show this morning, we're going to talk about snoring. For some people, snoring could be simply annoying, but if left untreated, it can seriously impact their health and social life. But interestingly enough, it may also significantly reduce a person's quality of sleep and life. As we know, sleep hygiene is very important, right, Shahnaz?
That's right. Now, a study from the United States said that snoring possesses more risk than smoking. Now, to find out more about this, let's invite ENT specialist Dr. Anggina Diksita Pamasya to the studio. Good morning, Doc. How are you?
Well,
Thank you for coming.
Happy to have you here to talk about snoring.
All right. Now, we want to know, Doc, some snore simply because they're tired, right? While others may have health problems. Now, what's the difference between these two? And is there anything we should look out for if it indicates respiratory disorders?
Okay, thank you for the question and nice to meet you both. Actually, snoring could happen to anybody, but we should aware if there's something respiratory distress.
Like how, Doc? How do you?
When you got sleep apnea.
Okay.
So sleep apnea is sleep related to breathing disorder. Okay. So if you have breathing disorder, you should go to see the doctor.
Okay, straight away. Okay.
So what is the most dangerous risk of snoring that we should anticipate?
That sleep apnea, or we call it obstructive sleep apnea. Sometimes we call it OSA. Maybe you already hear about OSA, yeah? Because sleep apnea can be risk factor to get the cardiovascular disease. And even more, long-term snoring, it can lead to greater risk like heart attack, diabetic, and stroke.
So how do you know if it's just a normal snoring or it is actually a sleep apnea?
Now, when you have any of these symptoms, you should see the doctor. What is that? It's like including like weaknesses, breathing pause during sleep, and then excessive daytime sleepiness, and then morning headache, or some sore throat after you awakening, and then poor performance in school for kids, difficulty concentrating, or maybe you just can't sleep when you watch TV and then you can sleep, or in the car, you just go in like 1 hour and then you just go to sleep, and behavior issue for the children. So OSA can happen to adult and children.
Oh, okay.
Not only for adult.
One more question. What actually causes sleep apnea?
Okay, the main cause of sleep apnea actually, it can from nasal blocking.
Nasal block.
So if you have any allergy, sinus infection, nasal polyp, or sometimes structure anatomy, like deviated septum, it could make nasal blocking. And then poor muscle tone in your throat and tongue, because when your throat and tongue is too relaxed, it can make collapse in your throat and then make upper airway blocking.
Okay.
And the other one, it can make cause sleep apnea. You use drugs or alcohol, because it can make your muscle tone too relaxed.
Okay.
Yeah, something like that.
Something like that, okay. Now, Doc, before we go further and talking about this snoring problem, can you please explain the healthy sleep habits to us so we know that we're on track, on the right track?
Yeah. Okay, so first you have to stick to your sleep schedule.
Okay.
Okay, remember, you have to stick to your sleep schedule.
Okay.
And then I suggest you to sleep side lying, so you don't sleep to your back.
Okay.
Because when you sleep on your back, it can make collapse on your tongue, go to the back, and then make collapse, and then the upper airway is blocked.
Okay.
And then the other one is raise your head a few inch.
With a pillow.
Yes.
Okay.
So don't use too soft or too large pillow. You know what I mean? Too soft pillow. It's just your head to just go too down, and then your head is not raised enough.
Okay.
Right.
So just raise your head a few inch, so it can avoid to do snoring.
Okay.
Why is it that some people snore and others don't? You mentioned it can actually happen to everybody.
Yes.
And it seems that a lot of people sleep lying back, right?
Yes.
And they don't snore. So
Yes.
why some people snore and the others don't?
First, maybe you already heard that some people who snores is often we found that they are a little bit fat.
Okay.
Okay.
You know, so obesity can make snoring. Why? Because the obesity, people with obese, it has bulky throat tissue. So there's bulk in the neck. It can make your throat is narrow. When your throat is more narrowed, it make forceful to your airflow, and then make the tissue vibration that can cause snoring.
Oh, okay.
Yeah.
Okay. So, okay, we know now that obesity has a huge factor on snoring.
Yes.
But how about age-wise, doc? Because some kids do snore, right?
Yes. Nah, like I said before, snoring can happen not only for adult, but can happen to the children. Why? Usually children have big tonsil. You know, in Indonesia we call it amandel.
Amandel.
Yes, that amandel, that tonsil, it could happen in your throat, and then some children have adenoid. Adenoid, it's kind of a tonsil, but in the nasopharynx, so the deepest side of the nose. So when the children had big tonsil and adenoid, it can make narrow. It can make the airflow is forceful because a narrow system in the upper airway. When you have a children like that, you can see that they are snoring, and then they get poor performance at school, behavior issue, and then poor attention and poor concentration. You should go to the doctor because we suggest you to do the operation.
It has a lot of effect to
Yes,
their
yes.
daily lives.
Yes. And one more things. Sometimes we found that and this is quite often we found that children with snore, with the OSA, with the obstructive sleep apnea, have failure to thrive. So failure to thrive, it means that your growth is stuck.
Wow.
Yes,
okay.
yes.
I see.
So
it's very serious.
It is
Yes,
very
it's
serious.
very serious, yes.
Now, but I think, so first thing first, you need to differentiate whether it's just usual snoring, or is
yes.
it OSA.
Yes.
Right? Now, wanting to talk about the usual snoring a little bit, right? It could actually be very affecting the other person's sleeping together, right? For
Yes.
example, when it's usual snoring and you hear the other person snore, is it true that this is kind of like a myth busting as well? Is
Yeah.
it true that you should wake them up immediately to save them?
It's a myth. Yeah.
It's a myth. Okay.
So it's a myth. Actually, you shouldn't wake up the person who snores when the person is just general snorers. But it's advised you to wake someone up when the person who snores because of OSA.
Oh,
So it's
okay.
different, right?
So we have to know, we have to differentiate.
Yes.
Okay.
And the OSA symptoms actually not only of snoring, but you can see in their day-to-day life
Yes.
the symptoms that you mentioned earlier.
And you have to witness that there's breathing pause during the sleep.
Okay.
So just sometimes they are gasping or choking
Okay.
in sleep.
When they do that, we can wake them up.
Yes.
Okay.
Because when you wake them up, and then you can adjusting their sleep position,
Okay.
and then maybe you can give them medication.
I see. What sort of treatment, doc, would you give?
It depends on the symptom, and it depends on the cause of the snoring or the OSA.
I see.
So we medicated based on symptom. But if you are diagnosed with OSA, usually we treat them with medication, and sometimes we need to give them CPAP, continuous positive airways pressure. So there's a machine that they have to wear it during sleep, and it will reduce the snore and will help the OSA.
Is there any lifestyle changes,
Of course,
recommendations
yes,
that you
of
can
course.
share for people that have OSA?
Yes, of course, of course. Lifetime changes is the most treatment actually. So maybe you can change your lifestyle with the exercise and then diet, healthy diet. It's very important.
I see. All right. So, what are the things that we need to do to help us stop snoring, Doc? First, that if we experience snoring.
What? Excuse me?
If we are experiencing snoring, what are the first things that we can do aside from maybe readjusting our position?
Yes. So if you are snoring, first try to find what is your main cause.
Okay.
Okay, if you have obesity, so you have to lifestyle changing to make
Like you
your
said.
Yes, like I said before. And if the problem is nasal blocking, I think you should take care of that. So we can use nasal spray. Usually we use nasal spray, and sometimes people with the bigger tongue or too long soft palate or uvula, maybe you can see in your throat, there's uvula. If it's too long, and sometimes we did surgery.
Wow. Okay.
Yes.
Okay, since you're an ENT specialist, and just before we go on air, you mentioned that anybody should be checking with an ENT specialist at least 6 months, once at 6 months.
Yes.
Does it actually also help with the preventing snoring?
Yes, of course.
So what do you actually get when you go to an ENT specialist? What the specialist done to you, and how does it relate to preventing snoring?
Okay, it's a good question actually, and I hope all people will watch this because I suggest you to go to the ENT specialist every 6 months. It's true because beside of the snoring, we have to check our ear, of course, our nose and the throat. So for preventing snoring, when we check every 6 months, we can know that when you have an allergy, if you have an allergy, automatically your nose will block, and we can give the medication and it will heal. Actually, maybe not heal the allergy, but will control it, and you won't have nasal blocking. It is for the nose, but for the throat, we can see if is there any big tonsil. So when we have a big tonsil, we have to lifetime changes. So no ice, no spicy, no cheeky, no
MSG.
no MSG. Yes, no MSG things, and so you have to lifestyle changes like that. No chocolate.
I see.
Wow.
I see. Healthy lifestyle does benefit everyone.
Yes.
So my last question would be, Doc, do you have any recommendations on good sleeping positions to help reduce snoring? Because you have said before that you shouldn't lie on your back, right?
Yes. So just adjusting your sleep position by side lying, and then raise your head up and stick in this, your sleep schedule.
Okay.
Stick to the sleep schedule. I
Yes.
think it's a bit challenging for us, right, Rasha?
Exactly.
But thank you so much, Doc, for coming. Thank you for explaining to us. I hope this can give, a different point of view to everyone who watches.
Thank you
Thank you.
for having me.
So much, Doc.
Thank
Happy
you.
to have you here.